I guess one of the first things to say is we don't fully know why we sleep, but what we do know is that it helps us with learning and restoration. So we kind of balance out our hormones when we're asleep. It seems to improve our immune function if we get good sleep, and it helps with brain development and consolidation of memories. So if we've got, for example, practicing to play a piece of music that we have to learn, it's been shown that it's better to practice a bit and then sleep on it than to just practice. So sleep is a very active process, and there's things that we don't have conscious control over that are useful that happen when we're asleep. There's two main processes that govern sleep. So there's the body clock, the circadian rhythm, and that's very much set by daylight. So that's why what we do in the day is really important in determining what happens with our sleep at night. And one of the key things that we recommend is getting at least 20 minutes of daylight as soon as possible after we wake up. So that's easier in the summer than it is in the winter, but you can replicate that with artificial light. Sometimes people use blue lights. So blue light is the most powerful at making our melatonin levels drop, and that signals it's time to be awake. Blue light also comes out of phones and smart devices, so that's why we recommend trying to reduce them during the night and in the evening, in the run up to bed. And the other process is sleep pressure. So the longer that we're awake, the more sleep pressure there is, and that's partly why as we go through the night our sleep gets lighter. So by 3, 4, often there's very little sleep pressure left to keep us asleep. So signs that someone might be lacking sleep is that they might be falling asleep during the day or at inappropriate times. They might take more than about a quarter of an hour to get going in the morning. They might sleep in longer at the weekend. So if they don't have to get up, then they might stay asleep. And you might notice that if they get better sleep, their mood or their behavior improves. 3 essential foundations to sleep are a consistent sleep schedule, a regular bedtime routine, and an appropriate bedtime. And it's worth noting that an appropriate bedtime for one child of 6 might be different to that for another child of 6. So every situation is different and every child is different, but trying to maintain those 3 things is likely to be helpful.